Yeah, I think awareness of your family history is really important. Many of the causes of cardiac arrest, unless it's something like commotio cordis, which is what Damar Hamlin experienced, there are arrhythmias that can travel in families. And so knowing your family history, knowing if there's been a history of arrhythmia, sudden cardiac death, or unexplained death. Maybe there was a family member who was diving into a pool, was a good swimmer, and then, drowned. That's something that would be worth noting. Maybe there was a family member who was very young, but had a heart attack, or was what was recorded as a heart attack. That's information that should be shared within a family and be helpful when thinking about, risk for the child. So for congenital heart disease, as you highlighted, fortunately, many of the diagnoses can be made in the womb through fetal echocardiography. Pediatricians should have a conversation with the mother, ensuring that those tests were performed and knowing what those results were, ensuring that scheduled follow-up with a pediatric cardiologist takes place in a timely fashion if there have been concerns for any congenital abnormality, particularly of the heart. As a child grows, depending on the severity of the congenital heart defect, procedures may have been performed, surgeries may have been performed. Knowing what those procedures were and what a child may be at risk for certainly is helpful and is something that a pediatrician will want to know. And then as transitions occur, so beginning when we did work with the American College of Cardiology some time ago, we talked about when, in fact, to begin conversations about transition. And it starts quite young. It actually starts in early adolescence, getting the family prepared for when that ultimate transition of care will happen. But because we do know that that is a time, particularly as kids matriculate from being, say, 18 or 21, living in their parents' home to going off to college or going out on their own, that is a period of time when we do tend to see fall off in terms of follow up with a specialist, a heart specialist, including pediatric cardiology. And now we have adult congenital specialists who patients can follow up with. So it's really important to have those conversations early to understand the scope and the severity of the heart defect that a child has as they, after it's born and then later on, but also to understand that transitions of care are important, and that is a time frame in which many kids, whether they have congenital heart disease or not, in fact, do fall off from care. Yeah, so obesity unfortunately is becoming more prevalent. Current estimates suggest that 60% of adults have obesity or overweight status. And the prevalence we quote as 20% in children. I would argue that number is continuing to increase. We did see a surge during COVID when kids were sort of separated from being able to exercise and food choices weren't always the best. And we have seen some improvement in overall BMI and prevalence of obesity, but it's still quite a bit of a problem. The way that I think about the relationship between obesity and cardiovascular disease and later heart disease is through something called the cardiovascular kidney metabolic framework, or the CKM framework. We published this presidential advisory and synopsis back in 2023. And what this CKM framework describes are stages in which a person, child or adult, goes from having zero, stage zero, which is the absence of any risk factor for cardiovascular disease, to stage one, which includes the presence of dysfunctional adiposity or obesity or overweight status. And then because adiposity or adipose tissue is a living tissue, the physiology changes. We do see development of insulin resistance. We see activation of the sympathetic nervous system, enhancements in the renin-angiotensin-aldosterone system. You will see increases in things like dyslipidemia, triglycerides. You also see elevations in blood pressure. And then from there, we often will see progression. So progression in terms of renal disease, as well as cardiovascular disease, subclinical heart disease, and then on to actual clinical heart disease in stage 4. And so it's interesting because we used to think about this trajectory, if you would, as linear, but it's not linear. I would argue it's actually a circle. If you think of Simba and the circle of life, it actually quite actually is the circle of life. What happens is that maternal risk factors, possibly paternal, but certainly the maternal environment is the first home of the fetus, the first home of the child. That environment's crucial to overall ladder risk as well. So if a mom's health is not ideal, that can also pose risk not only to her, but to offspring. So we do know that there's a relationship between maternal obesity, moms having uncontrolled maternal disorders of hypertension, so they can have preeclampsia or gestational hypertension. And those things are risk factors for offspring developing hypertension. But in terms of from an obesity and diabetes standpoint, certainly we do see relationships between that environment and offspring obesity later, but also what happens during the first year. So how a child is fed during that first year is very important. We've done some work in this space, given some talks, and we have some publications. But if you look, the best sort of nutrition for a child, and I know this is controversial and this may not be true for in all situations, but certainly there is argument and data to support that breastfeeding is a very, very good source of nutrition, and arguably the best sort of nutrition source for nutrition for an infant. And the longer the breastfeeding, the better, within reason, obviously. And then introduction of solids, certainly after 6 months, can be helpful. Not wanting to introduce things that are very sweet to kids as a first food is really important. But then trajectories of weight gain during that first, depending on the study, it's year, 3 years, 5 years. And often you don't see the onset of obesity right away. Sometimes the risk factors occur during that early time period, but then you actually see an increase in BMI 8 to 10 years of age. And so there's this protracted course, if you would. And then once a child has obesity, what can happen is that can persist. And if it persists into adulthood, as I mentioned, you have the CKM framework. So you have dysfunctional adiposity or obesity, then progressing into the addition of these other comorbidities. And then in what we describe as your overall cardiovascular health, right? So we can score that. So your BMI, whether you have obesity or overweight status, your blood pressure, your cholesterol, your um, blood sugar or hemoglobin A1C, and then your lifestyle. We sum all of that into a score and call it Life's Essential 8. It also includes sleep, it includes exercise, it includes diet, it includes use of tobacco products, including vaping. And if those things are poor, we know that that is associated with a poor long-term cardiovascular health and greater risk for heart disease and heart attack. Likewise, if those things are very good, particularly as you enter into early adulthood, so around 18 years of age, if you have ideal cardiovascular health at that point, so you don't have obesity or overweight status, or you have normal blood pressure and all of those things I listed, you actually have like a 74% lower risk of premature heart disease as an adult. So all of these things are related. So it's a lot of information I know for a pediatrician to consider, but it does matter what a child's health status is. We can't just think about, oh, well, they'll kind of grow into it. Some do, but many don't. And so it's important to understand that, yes, in fact, having those same risk factors that you think about for adults in childhood is a risk for heart disease in adulthood. And the last thing I'll say is this. I was a math major in school, so I think mathematically, but so bear with me for those who don't like math, but area under the curve. So think about it like this. If I'm a child and I'm exposed to this high risk for more time, the area under the curve is a lot greater than if I'm an adult with onset of this disease because I'm exposed to this risk for a much longer period as a child. So, again, thinking about heart health from its earliest onset, how a child is fed, how active they are, um, maternal health is important, and advising young women, whether they choose to be mothers or not, on the importance of heart health is also critical.